I'm Jay Katz. I'm the director of the Glaucoma Service at Wills Eye Institute here in Philadelphia. I've been treating glaucoma for over 25 years. My colleagues and I comprise the largest glaucoma department in the country. Wills Eye Institute has been in existence since the 1800s, helping patients with their vision. Glaucoma is a very important disease I'd like to tell you about. It is the #1 cause of irreversible blindness in the world today.
Glaucoma is a complex disease that damages the optic nerve, the cable that links the eye to the brain, and is responsible for processing vision. Glaucoma damage leads to progressive, irreversible vision loss. In an eye with glaucoma, the fluid does not drain properly, creating increased pressure in the eye. The high pressure can damage the optic nerve.
Most people with very early glaucoma aren't able to tell that they have any problem at all.
I don't even know I have the glaucoma before that. I don't have any symptoms, and I feel good. I read everything clear. I don't need reading glasses, so I feel I have perfect eye until I found out the glaucoma.
The only way it can be diagnosed early is by having an eye examination. That eye examination consists of several different factors. One, you have to have the eye pressure measured by a machine called a tonometer. It is painless and you don't feel it. Secondly, you have a visual field test done, checking the side vision, because often the side vision that's lost very early on, you are unaware of yourself, but we can actually detect it by using the visual field test machine. Finally, we can look directly at the optic nerve, and the optic nerve will show features of damage that we can see that you might be unaware of as well. We sometimes will photograph the optic nerve to document how much damage there may be. 50% of people who have glaucoma in the United States today have yet to be diagnosed. We're hoping to decrease that number by better screening and really identifying all those with glaucoma. The people that should be the most concerned about whether they might have glaucoma are people over the age of 60, those that have a family history of glaucoma, or if you're African American, Hispanic, or Asian American, you again are higher risk for developing glaucoma. So for all those settings, I'm hoping if you fit one of those categories that you take advantage of the opportunity of having an eye examination.
Having that exam was extremely important. Had I not had it done, I might not be able to see today.
Glaucoma is a terrible thing to have. My mother had it, my husband has it, and it's not good all the time, you know? It complicates your life in so many ways you would never know.
With me, I was the first one to be diagnosed in my family. After talking to other family members, they got diagnosed. And there are at least 4 that now know that they have glaucoma and are getting it treated.
We're all excited to have you here to have an opportunity to test and screen for whether you have glaucoma, and encourage all of you that have the disease to be treated early on to give you the best prognosis and the best opportunity to save your vision.
The best treatment is early treatment.
Glaucoma treatment can start in very simple ways, from everyday drops to a painless laser procedure that does not affect your vision.
If we're able to successfully lower the pressure in your eye, if you have glaucoma, then we can maintain your vision. And then you don't have to worry about losing the ability to drive, losing the ability to read, see your grandchildren growing up. All these things I know are terribly important for all of us.
If you're ever diagnosed with glaucoma, there's one of 2 ways you can deal with it. You can go and see your physician on a regular basis and have it taken care of, or you can do nothing and go blind. Don't wait until you can't see and say, oh, I think something's wrong. By that time, it's too late.
Sign up today for the glaucoma screening. It's very important. Get it done today. Very important. Don't be like me.